So I did develop gynecomastia during puberty. It just seems like one day I woke up and I had one sort of boob that was there and one nipple that was like significantly larger than the other one. And I was like, this is weird. So I went to the doctor and the doctor says, oh yeah, this happens.
Yep.
It's going to go away.
Mm,
And
they gave you some raloxifene, didn't they?
nope, I don't even know if they gave me a pat on the back, but that's about the closest thing they gave me to treatment. My surgical health update, I guess, is a bit more overdue, but I am fully recovered from gynecomastia surgery now.
Yeah. It seems like your recovery took a bit longer than my one-day recovery for this.
Yeah, I think people looking back now will be able to kind of put two and two together and be like, oh yeah, James was wearing sweaters and a white t-shirt underneath those during those episodes
True.
due to that compression garment. Yeah, that thing
Yeah.
was a necessary evil, I suppose. But
So I guess you somewhat explained your CAG repeats and whatnot, but was this pubertal gyno? Was this prophylactic so that you can now blast huge amounts of gear and become an IBBF pro, whatever it's called? I don't know what it's called.
yeah, no to the latter, yes to the former. So I did develop gynecomastia during puberty. It just seems like one day I woke up and I had one sort of boob that was there and one nipple that was like significantly larger than the other one. And I was like, this is weird. So I went to the doctor and the doctor says, oh yeah, this happens.
Yep.
It's going to go away. And
they gave you some raloxifene, didn't they?
Nope. I don't even know if they gave me a pat on the back, but that's about the closest thing they gave me to treatment. Basically nothing, monitor it, and it will go away. And it never went away completely. I think I ended up developing it on the contralateral other side, although it was always a little bit worse on the left.
Mm-hmm.
So I've kind of had this, on and off, and really didn't start having a lot of, nipple pain or nipple sensitivity until being, on testosterone and then being on both dutasteride and finasteride seemed to not necessarily cause more tissue growth, but definitely increase the sensitivity if you're thinking about the balances of the androgens and the estrogens there.
Mm-hmm.
So being the rational and calculated person I am, I said, well, I'm either going to have to get multiple hair transplants or I'm going to have to get gynecomastia surgery. So I figure I'll get one gynecomastia surgery and one hair transplant at some point.
That's very reasonable. So why do you say you would need a hair transplant? Is that because you do not want to take an aromatase inhibitor? Because Dr. Huberman said on the Joe Rogan podcast that prolactin is the cause of gynecomastia.
No, it's interesting. My prolactin numbers have always been low. I don't think I've ever had a high prolactin, probably because I'm not a marijuana or kratom user. Those are very common causes now.
How about IGF-1? Do you think that was high during puberty? That can cause
Probably
gynecomastia.
so. Yeah,
Isn't that how Anadrol supposedly causes gynecomastia?
The mystery gyno from Anadrol?
Yeah.
Yeah, I think you get a lot of growth signaling from that. And certainly having higher IGF-1 would tend to. Now my IGF-1 tends to be ballpark around 200, which I suppose is relatively high. Not unexpected, being in my 20s.
Did you have metabolic syndrome in adolescence when you worked at McDonald's for a year? Serious question, by the way.
I was actually very, very thin. So I was probably less than 100 pounds when I developed gynecomastia. I know when I was 16, I was like probably about the same height as I am now, just shy of 6 feet and 120 pounds. So I was very sort of skinny. I was what you would call a hard gainer, which means I didn't eat enough.
I see. Yeah, that was pretty skinny.
Yeah. And
when I was 20, I was probably skin and bones, 180, maybe 185. Just pure skin and bones. Yeah, I was pretty athletic, though, thinking back on it. Yeah, I was like a shrunk down version of Victor Wembanyama in the NBA. If people know who that is, he's like 7'5" freak,
about a foot shorter.
Yeah,
but
the same shorter. Yeah, with much smaller hands. His hands are like dinner plates. Anyway,
yeah. I did
I
partake in the
digress.
McDonald's food, but that wasn't until I was between the ages of 16 and 17. I probably ate there 3, 4 times a week, depending on how many shifts I was making or
Yeah.
working, and depending on who the manager was, if they let me also get a breakfast sandwich while I was working in the mornings.
Yeah.
Some of them are like, "Oh yeah, you're fine," and then some of them are like, "No, that's stealing. You're gonna drive this company into the ground."
Goodness gracious.
But
Wow, I can't believe that actually happened. Um, anyways, how long was the recovery? Was it a couple weeks? Like, what was the people that are considering this? What was the bad part of it?
yeah, not being able to fully exercise for 6 weeks. So uh, the day after the procedure, I was doing some cardio on a stationary bike. That's fine to do. Basically, you don't have to be totally sedentary for 6 weeks. Within a week, I was doing legs again. Probably 3 weeks post-op, I was doing some light upper body stuff. Not a lot of pushing, like pressing movements, not a lot of rowing movements. And then 6 weeks with the surgeon's blessing is when I was able to go back and start incorporating pushing, pressing, full range of movement,
Mm-hmm.
some stretching, like even hanging from a pull-up bar is something that I like to do for shoulder health and mobility. It just feels good.
Mm-hmm.
That was slightly uncomfortable at 6 weeks because it does put a lot of tension on those surgical scars there.
Yep.
And there was some tissue adhesion. And now that's starting to regress a little bit. I do have some scar tissue. I've actually thought about just sort of hitting it with a massage gun. That may be a scenario where my prolactin spikes due to the nipple stimulation, although
Yeah,
less so
that's true.
since I don't have mammary glands. Maybe I'll do a 30-minute massage gun session and then check my prolactin the next day.
Yeah. Let me know how that goes. Yeah. Other things that increase prolactin, for those wondering, tonic-clonic seizures, orgasms, particularly strong orgasms, and potentially certain types of like really hard workouts, maybe just a touch, but more likely related to nipple stimulation. That's how a lot of midwives try to kind of simulate, well, not just prolactin, but also oxytocin release. I forget what method it's called.
Oh, and then sauna. That one I think is very short-lived because I've done a sauna session in the evening, labs the next morning, and prolactin was also normal. So I don't think that it's causing a sustained release in prolactin. So if you got your prolactin at least 8 hours after a sauna session, it's probably not elevated due to the sauna.
Yep. Yeah. I don't think I've ever had a high prolactin, although I did get some labs recently. So maybe it did elevate. I don't know.
Yeah. Let me just pull up the prolactin here. Let's see.
When I got these labs, I would say I was less healthy than I have ever been in the last 3 years. Been getting up a lot at night. My sleep is terrible, and I have exercised very little. I did the Battle Bunker Hybricon games designed by Hunter, the High Rocks guy. I think I did that, 2 or 3 weeks ago, 2.5 weeks ago.
Yeah.
And after that, I was taking it easy for a bit and doing a bit more running. But yeah, far fewer gym sessions in the morning, and I've been eating a lot more sugar and junk. So I expect these to be pretty bad. And also, I was trying to take it easy and let my heart rate metrics, my heart rate variability, my resting heart rate kind of go back down to like true normal before getting the surgery. So I did that, and then I started back up with CrossFit class this morning.
Yeah, I was going to ask you. You reassured all the CrossFitters listening. They thought that Dr. Gillett was going to bail out of CrossFit and become a Hybricon athlete.
Well, I'm still probably going to do that. I do plan to do a High Rocks, and at some point, I'll probably. I've ran a half marathon before. I'll probably jog another one of those, and maybe a few other things. But I'll still do the CrossFit stuff.
Yeah, as for me, I'm just training for the Gillett Health Games. I think we can call them that.
Yeah, the fitness assessment. It's a modified Army fitness test, the ACFT, except we've removed, it's supposed to be gender and age neutral. We've removed the push-ups because those are not gender neutral. And we've also switched back to the old version, which has the leg tucks instead of the plank. Much better assessment of like fitness, grip strength, core strength, rather than just are you willing to grit through the pain with
the plank is really a willpower test, right?
Yeah, it sucks. Yeah, so I guess it's not bad to test willpower, especially for the military, but for a fitness assessment, you shouldn't be testing things like planks or snatches or kipping pull-ups. But again, no need to dive into that too much.
We did substitute the push-ups for incline barbell and dumbbell bench press. People can choose their strength.
Yes.
Which I think is much more exciting than push-ups. It'll certainly be much more exciting to watch.
Yeah.
Because there are a lot of people that are going to for sure max that event, but there are people who are going to be very close. So it'll be exciting to see how that goes.
Yeah, definitely.